This is a strain that is less severe but more contagious. And as a result, we are dealing with much higher levels of cases, which is why we're having to change the testing arrangements, the isolation arrangements. And so we need to ensure that we are focusing those testing resources on the essential tests that are required, not the casual tests.
The result of the surge in cases is a radical overhaul of the testing system, designed to remove some of the structural forces driving long PCR testing queues. PCR test requirements for returning expats, interstate travellers, truck drivers and hospital patients will be removed or replaced with rapid tests. Even sick people and confirmed close contacts showing up at testing centres will be triaged, some to be given rapid antigen tests by nurses on arrival and others given kits to take home.
These point-of-care tests can also be administered at testing sites themselves. So you will find yourself in the course of the next couple of weeks, they'll be transitioning where you'll be either be getting a rapid antigen test provided at that site and you'll get your result there and then, within 15 minutes. You won't have to wait for the test results to come back from the lab.
The shift to rapid tests, at least for now, means that we risk losing track of just how many confirmed cases of the disease are emerging, as there is no simple system in place yet for people to register their test results.
Without confirming positive rapid tests, how will Australia keep track of case numbers, or are they effectively redundant now?
Yeah, states are now working on a process for reporting where they move to rapid antigen tests, which are being done at home. But as I said yesterday, the most important call to make is to your doctor. Case numbers are less the issue. It's connecting to care that is the issue, and the Commonwealth provides the telehealth support for people to be able to do that and to get advice on how they can manage their infection at home.
Of course, that throws pressures back on the GP network rather than hospitals to provide a lot of health care when many Australians don't have a regular GP. Several states, Victoria, South Australia and Queensland, have this afternoon announced people will be required to report the results of their rapid antigen tests from as early as tomorrow. The states are now in the process of importing millions of rapid antigen tests to be distributed for free through testing hubs. Concession card holders will be able to access up to 10 free tests over 3 months through pharmacies. But the global shortage of the tests means there will be a shortage of supply to purchase in shops for some weeks. Anti-hoarding and price gouging provisions are being put in place for when more tests arrive in the country that will ban selling them for more than a 20% profit.
They should only be getting those tests there if they are not symptomatic and they are not close contact. If you're symptomatic and a close contact, you can go to the testing centre as many times as you need to. All of those tests are free.
The focus on the provision of free tests overshadowed other huge changes to COVID rules agreed at yesterday's meeting. Most significantly, changes aimed at getting critical workers in areas from aged care to transport back to work faster, with an obvious risk that they may still be ill.
We'll be able to get aged care workers back to work more quickly, and also for healthcare workers by changing the isolation arrangements. We'll be over the next week working on how we can extend and those arrangements to what we would define as critical workforces.
The government also plans to clarify workplace health and safety laws to make clear employers do not have to impose testing requirements on workers. This removes yet another hurdle to businesses being obliged to close or furlough workers who might be ill. Millions of children returning to school, just as daily case numbers are expected to peak at the end of the month, looms as another crunch point.
What we want to achieve is that those schools and the kids go back and stay back.
The Prime Minister says his departmental secretary, Phil Gaetjens, is developing a framework that will allow students to return to school and stay open. It will be presented to National Cabinet next week.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.